yours today. Can you verify your name and your birthday?
Jill Smith, 10/5/54.
Perfect, just checking your band there, good. And then it looks like it is time to administer some of your medications. Is that the provider had ordered? Sound good to you?
Yep.
Any allergies?
Sulfa and betadine.
Sulfa and betadine, got it. I don't need to wear any gloves as there's no, I likely won't be exposing myself to any bodily fluids, but if that would happen, then I would wash my hands right away, put gloves on if necessary. Okay, and then, are you in any pain today?
Nope.
Nope. Do you take any medication or can you take medication by mouth okay?
Yep.
Awesome. And then are you comfortable?
Yep.
Perfect. Any concerns while I'm here currently or questions?
Nope.
Nope, all good? Okay. So verified myself, provided privacy, hand hygiene, medication, allergies. Okay. So then I will go get the medication ready for you then, okay?
Okay.
Awesome. I'm gonna come out and hand hygiene again, provide privacy. All right, so I have, these are the labs here. Here's my med cards. All right, so first, just looking at the furosemide or the Lasix, some nursing considerations is to assess the fluid volume status. So that means the intake and the output. So what comes in, hopefully it comes out and is not retaining anywhere. So watching for swelling with that. Also listening to the lungs as well, watching for any dehydration or hypotension, or even signs of hypertension. As well, if there was any fluid buildup, the blood pressure would likely elevate as well. So that was the 4 nursing considerations for the furosemide or the Lasix. So then looking at the labs here, so with the furosemide being a diuretic, it pushes fluid out. So we would look at potassium, sodium, electrolytes for this one. So looking here, we have the sodium, the potassium here. As you can see, they are each, so the sodium here would be 5.2, so it's just 2 points higher. You got the, the sodium here is 1 point higher, and that would be okay to give, but just because it's not within the therapeutic normal range, we'd want to ask to verify. Also the kidney function here, the high end of normal, so the cutoff for the therapeutic range is 1.1, the patient has 1.2, so either way, just being not within those ranges, it'd be a good idea to check. So that would be a reason to hold the furosemide. The next medication is the warfarin or the Coumadin. Some nursing considerations for that would be to monitor the blood studies, such as an INR, to monitor how thick or thin the blood is. We would want to have the patient watch for any black or tarry stools, any signs of hypertension or hypotension. Hypotension could indicate that the patient is potentially bleeding somewhere inside. And then it's also important to assess for any fevers, rashes, or hives as well. So then looking the lab here, so we have the INR being 2.6, and then the range for the INR is, the normal range is 2 to 3.5. At risk for bleeding is 3.5 plus. So with patient being 2.6, they're in their therapeutic range there. So the warfarin or the Coumadin is okay to give then. So the next one here is the digoxin or the Lanoxin. Some nursing considerations for that one would be to assess and document the apical pulse for 1 minute. The digoxin could have the patient's pulse go below 60, which is not something that we would want, since anything 60 to 100 is normal and below 60 would be considered abnormal. We would want to monitor electrolytes with this one as well. Monitor any EKG, monitor any atrial dysrhythmias on the EKGs, and also watch the electrolytes, the potassium level. You can even watch the patient's weight with this one as well. And then digoxin level is 2.2, whereas the therapeutic range is 0.8 to 2, so with that being 2.2, it's above that therapeutic range there, so this one would be held as well. So the next one we have the codeine with the Tylenol or the Tylenol 3. Some nursing considerations with this one is to assess pain. So the type of pain, anything that alleviates the pain, where it's at. Watch for any nausea, vomiting, some constipation with this one as well. And then also monitor for any drowsiness, dizziness, or hallucinations. And then as always, it's important to also monitor the vital signs, so pulse, blood pressure, respiration rate, especially because the pain medications can cause some respiratory depression, so it can slow the breathing down. So it'd be important to watch kidney function, liver function with this one as well. But the patient stated no pain today, so we won't worry about this one. So the next one we have is the oxycodone with the Tylenol, also known as the Percocet. So some nursing considerations would be to assess the pain again, so the type, location, the severity of it, monitor the intake and output, especially the output, because this medication can have a factor in urinary retention as well. It's important to assess for dizziness, drowsiness, any hallucinations, also to watch for rash or hives or constipation as well. This medication also causes respiratory depression as well, and also important to monitor the kidney function, liver function with this medication as well. Alright, so then looking here at the orders, we have the orders here, and we have the MAR. So just looking to see if there's an active order here. So we have Joseph Smith, 10/5/54, good. Looking at the order for the medication, we have the warfarin, the 5 milligrams by mouth daily. It does not look like he has had it yet today. So you have the right patient, right medication, right dose, right time. It would be for the patient's AFib, and then it has not been documented yet. So far so good, this matches up. And then I can put the orders away and then just keep the MAR out. So then this is where the first check would start. I'm gonna snag the warfarin here. So comparing it, the medication to the MAR, we have the warfarin or the Coumadin, the 5 milligrams by mouth daily. We have it for Joseph Smith. So we have the right patient, the right medication, the right dose, the right time. It has not been given. This would be for his AFib, the warfarin would be. And then looking at the packaging here, we have the expiration date of 4/2041. Package has not been tampered or opened. It is not scored, so we wouldn't cut it in half, but the dose matches, so we wouldn't have to cut it in half either way. So either way, the patient can get a full tablet. So we'll put this in the cup, and that's where we can do the second check here then. So then taking it out of the cup, we have Joseph Smith pulled up here again. We have the warfarin, the 5 milligrams by mouth daily. So you have the right patient, the right medication, the right dose, the right time. It has not been given yet today. And then, let's see, has not been given yet. And then we have expiration still being 4/2041. Medication has not been opened by any means. And also will not be needed to be cut in half or scored or anything like that. The patient can obtain a full tablet here. Alright, so that would be my second check. So then I will take the MAR with me, and then my card, the medication, good. And then I will go into the patient's room. So knock knock. Let's see. Open, coming on in. Hi. Caitlin, the student nurse, coming back again. I have a medication here. I'm going to provide privacy, do my hand hygiene, and then just one more time, your name and your birthday.
Joe Smith, 10/5/54.
Perfect. And then another time, any allergies?
Sulfa and betadine.
Sulfa and betadine. Are you having any pain?
Nope.
No pain. All right. And then so far, are you comfortable? Any concerns?
Nope.
Nope, not yet. Or not at all. Good. Okay. Good. So I have your warfarin here. Okay. All right, and then you're comfortable, and you said you can take medications by mouth.
Mhm.
Okay, so I have your warfarin here. Your warfarin is a blood thinner, and it is for your atrial fib, your AFib, so for your heart there. I'm just gonna let you know some side effects of that, okay, for you to watch for. So some side effects here would be some possible to have some nausea, it looks like. We'll watch for a rash. Can't read my own handwriting. Yeah, so nausea, upset belly. Watch for any signs of bruising. Okay. All right, and then which medication do I have here?
Warfarin.
Awesome. And then can you tell me what it's used for?
AFib.
AFib. Okay, and then can you tell me a side effect to watch for with that?
Nausea.
Nausea? Okay. Sounds good then. And then we'll also watch for bleeding for sure with that, since it monitors how thick or thin your blood is. Okay? Alright, and then, so again, at bedside, we have Joseph Smith, the warfarin, 5 milligrams by mouth daily. Patient has not taken it yet, as indicated. So we have the right patient, the right medication, the right dose, the right time. Patient has not taken it. And then the patient can't take it by mouth. So just showing that the package is not open yet and it's not expired, so then I'll put it in the cup for you to take. And then would you like to take it with some water or?
Yeah.
Okay, so medicine and water. Good, thank you. All right, and the time is, say 15:27. 15:37. I got my initials and then the date. So documented that the medication was given. Since it is a tablet form and not a dissolvable, like a sublingual or one that would go in the cheek, since it's not a dissolvable, I would reassess after 30 minutes for any adverse reactions. So then if any reactions would happen, further doses or any further doses would be withheld. The pharmacy and the provider would be notified. It would be documented for sure. And then, so monitor vital signs, any doses withheld, provider and pharmacy notified, and then documentation, of course. Is there anything else I can do for you while I am here? Any questions?
No.
No? Okay. So then I would make sure that the bed is low and locked, and gotta make sure I scan. Beep, good that it was given, and then move on to make sure the bed is low and locked. Side rail is up. Good. And then the room is risk-free, any hazards. Table is near, call light is near, and then I will hand hygiene. I will document any abnormal or side effects for agent policy. And I would do my own documentation into OneNote as well as to why specific medications were withheld. And then I'll clean up my supplies. Here's your table. That's for you. You're welcome. And then I would come out, hand hygiene again, provide the patient privacy, discard any medication here, and do my documentation.